I'm Dan Nicolau. I'm a reader and an associate professor basically in immunobiology at King's College London at Guy's Hospital. And I'm also the director of the King's College London AI for Science program, which at the moment encompasses two things: a master's in AI for Science, we think probably the first of its kind in the world, and an AI entrepreneurship hub called the KCL AI Nexus, and with some more initiatives to be developed over the next couple of years, like an AI MSc Neuroscience, an online version of the AI for Science MSc, potentially an AI for Engineering Masters, and working towards developing a suite of programs like that, but basically equipping young scientists and young engineers with the AI tools and perspectives to do well later.
So I see the stethoscope. Can you tell us a little bit about your medical background and your mathematics background in addition to your AI professor background?
The stethoscope is more a gimmick, although I did see someone earlier. So I'm a mathematician by training, and I did engineering as well. Later, I did a PhD in biology or mathematical biology, and I kind of got the medical bug, and I returned to medical school and became a medical doctor. Uh, but these days, I do almost exclusively research and AI type stuff. But in total, I have 6 degrees with what happens to be in clinical medicine.
That's really terrific. Could you tell me what seminar you're going to be running and what day it's going to be on?
Yeah, so that is going to be AI for healthcare, and it's going to be on the third day and the last day. That's the Thursday, the 30th, I believe. And in lots of ways, that, because Rory and James, the other co-founders, and particularly Rory, because he's the CEO and does so much. We're all medics. We all went to medical school together. Actually, that's how we became friends. And so, in a lot of ways, for us, I mean, we care about everything that happens in AI, um, especially to do with entrepreneurship. But that day, I think is the closest to our hearts because we are, you know, medics fundamentally. So, yeah, that's on the last day, and towards the end of the day, there'll be a panel on how AI is changing healthcare, and in particular, how can we scale? Can AI help to scale medicine and scale doctors and scale nurses? So I'm quite excited about it. And those panels, historically, when we've run these events before, have been really good, really high quality. I mean, everything we do at Thinking About Thinking is really high quality, but the those have been, like, crowd favorites. So I'm looking forward to it.
Super exciting. And if you can give us a little sneak peek, what are some of the big developments that you see happening in healthcare, specifically with the advent of AI, that you'd like to share with our audience?
Yeah, so of course I don't know, just like everybody else, although as AI for science director, I suppose it's my job to know or pretend to know. I think at a very high level, one thing that has not been said very much before, or I have not heard it said very much before, is that what AI can do for healthcare or for clinical care, for medical care, nursing care is, at the moment we spend a lot of our time chasing data and trying to get files, and the patients have become QR codes, and the nurses do data stuff sort of just like the doctors do. And so one big promise, and from my point of view, is that AI can help us to be free or more free of those things, so that doctors and nurses can get back to what doctors and nurses are supposed to be, which is carers. They was, or physician scientists, I guess in my case. But at the moment, we're data processing machines, and we're not very good at it. So I think what AI can do is return the heart to medicine and to nursing, so that we can be looking after patients, doing pastoral care, doing coordination, doing thinking about how to better, do things, how to better treat disease instead of being essentially like, bureaucrats. That's at a very high level, closer to planet Earth. I think electronic medical record integration and machine learning on those data sets to help us predict when someone's going to have clinical decline, when someone's going to get sick. For all its history, medicine has been on the back foot. That's why patients are called patients, because you have to wait patiently for the doctor to see you. We've never been able to get ahead. We've never been able to forecast when someone's going to get sick. And if you knew even hours in advance, in some cases, even minutes in advance, that something's going to happen that would completely revolutionize. It's almost difficult to imagine how much of a transformation that would represent for health. If you could say, you feel fine now, but in 24 hours from now, you're really going to need a lot of help because you're coming down with a respiratory infection or you're going to have a heart attack or something like that. I mean, just imagine, close your eyes and imagine for 30 seconds how different the world would look if we could do that. So I think that's the big hope for the medium term, long term. Yeah.
Oh, absolutely. Well, that's such good news. Thank you so much, Dan. I'm really looking forward to seeing you at the conference.
A great pleasure. See you soon.